Hi everyone. So today let's learn about physiological changes during pregnancy. Pregnancy is like a complete body makeover. Every system in the body changes, and this changes just to support the new life. Let's quickly dive into this fascinating physiological changes that happens during pregnancy. Starting with the introduction. So once one woman is pregnant, this pregnancy actually triggers a remarkable physiological adaptation to support the growing fetus. So this changes or adaptation represents the body's response to metabolic demand of pregnancy and growing fetus. There is a changes from the cardiovascular adjustment to hormonal shift. There is a change in every system like respiratory system, renal function, every system. There is a changes, and the need or the specific purpose for this changes is to ensure optimal condition for the fetal development. Okay, it is the purpose is just to provide a optimal condition for the fetal development and preparing the mother's body for labor, delivery and lactation. Okay, so as an healthcare provider, as a nurse, what we should understand is like we should be able to distinguish between the normal change from the abnormal. That is our job. Okay, so let's start with the uterine changes during pregnancy. The first is the uterus, the growth and the enlargement, which is the shape and the size. In non-pregnant uterus, the uterus actually weighs approximately 60 gram, which later on during pregnancy and once the woman reaches term, the uterus weighs around 1000 gram, which is almost 1 kg. Okay, which is 1 kg. And then the capacity of the uterus also from 5 to 10 ml, it increases to 1000 ml. Okay, and the length of the uterus also increases, which measures around 35 centimeter. So in muscle, what do we see in the muscle? The changes in the muscle. So here there is the muscles fiber undergo both hypertrophy and hyperplasia, especially in the first 12 weeks under the influence of estrogen and progesterone hormone. That is why the uterus weighs from 60 gram to 1000 gram. Okay, and then beyond 20 weeks, further elongation occurs due to stretching of the growing fetus. That is why the length of the uterus is 35 centimeter by the time the woman reaches term. Okay, now what happens with the vascular changes, the blood supply? So blood supply actually increase drastically, where the uterine artery, actually what happens, the diameter doubles. So that is why there is an eightfold blood increase by the time the mother reaches 20 weeks of gestation. So now let's a little bit learn about the position of the uterus. So as we all know, the uterus is actually positioned anteverted, right? It is lean little towards the it's leaned forward towards the bladder. So up till 8 weeks it is anteverted. After that it becomes erect, it becomes straight. And then typically by the time the woman reaches term, it rotates it dextro rotates, that which means it typically leans towards the right side, and then the cervix, it deviates towards the left. So it's like the cervix is like this and the uterus is rotated towards right side. Okay, and that what happens in the uterus, there is something called Braxton Hicks contraction. This is actually a painless contraction and it begins early in the pregnancy, and later on, when during term and during labor, it eventually merges with the labor contraction. Okay, Okay, so now let's see what all changes we will see in the breast. The first is the anatomical changes. There will be an increase in the size of the breast. Okay, especially this is evident in primary gravida than in multigravida, because in multigravida mother the changes has already been taken place. So that is why it is more prominent and evident in primary gravida mother. So how does this happen? The size actually increase because of hypertrophy and proliferation of duct and alveoli. So there is an increase in the size, and there is a number of the cells increases. Okay, so and this is all influenced by estrogen and progesterone hormone. Because there is an increase in the size of the breast, you will also see a cutaneous striation, which is also called as stretch marks. So it the stretch mark is not only seen in the abdomen, but also seen in the breast as well. Okay, so now what all changes can we see in the nipple or alveoli? So in a nipple, you'll find the nipple has been is enlarged and more erectile, and also develops a deeper pigmentation. So there is some gland called Montgomery tubercles. This also gets hypertrophied, and it also gets visible. So now the function of this gland is actually it secretes a substance that keeps the nipple and the areolae moist and healthy, and throughout the pregnancy and even after the delivery. Okay, so and also what happens is there is an increase in the vascularity. So hence you'll see a bluish color under the skin of the breast. So and also because of the axillary tail also becomes enlarged, hence it is also painful. Now also let's see about the secretory changes. So colostrum is something that it begins to secrete around 12 weeks of gestation, and as the pregnancy progress, it becomes thick and yellowish in color by the time the mother is 16 weeks of gestation. Okay, so this early milk production is also a sign of pregnancy, and it increases as the delivery approaches. Okay, so now let's see hematological changes, the changes in blood. Okay, so first is the blood volume actually increases by 30 to 40% by the time mother reaches 30 to 34 weeks of gestation. RBC mass also increases by 20 to 30%. Plasma volume also increases by 40 to 50%, but hemoglobin decreases by 2 gram. Okay, so blood volume, the RBC mass, and plasma volume increases, whereas hemoglobin decreases. Okay, the another interesting factor that happens is like there is a hypercoagulation state, wherein the fibrinogen level actually what happens, it rises by 50%, and there is an increased activity of factor 10, 9, 8, 7, and 1. So this is also the reason, and the purpose as to why these changes happens is like this is helpful during placental separation. That means during third stage of labor, it helps in controlling blood loss effectively. Okay. Okay, so now let's see the changes in cardiovascular. Okay, the first is the blood pressure actually drops by 5 to 10 mmHg by mid pregnancy, and this is despite increase in the cardiac output. The other thing what happens is the position of the heart also shifts. It shifts upwards and left, and left, where the apex moves to the fourth intercostal space. Okay, and also you because of this you'll also hear a systolic murmur due to decreased blood viscosity. And number three is there will be a supine hypertension, and this is actually because of the uterus being compressed, when the uterus compresses the vena cava. Okay, so and that is why the mother can feel a hypertension while she lies down in a supine position. And now what happens with the hemodynamic changes? There is a cardiac output increase in the cardiac output. There is a stroke volume also increases, and heart rate also increases. Okay, the cardiac output increases, stroke volume increases, and heart rate also increases. Okay, so now let's see the changes in respiratory and renal system. First, the respiratory. Here, what happens is the diaphragm actually rises by 4 centimeter, which means it moves upward by 4 centimeter. Because of this, there is a reduce in the lung capacity by 5%. Now, because of this progesterone hormone, there is an increase in respiratory drive, leading to rise in tidal volume. Now, because of this rise of tidal volume, there is a the partial pressure of carbon dioxide reduces and partial pressure of oxygen increases. Okay, hence eventually it helps in mother and fetals gases exchange. So now let's check about what happens in the renal. The renal function actually increases by 50%. Hence there is a rise in the plasma flow and glomerular filtration rate, and there is a reduce in the uh, creatinine and blood urea nitrogen, and then uric acid in renal changes. So now metabolic and endocrine changes. First, let's see the metabolic changes in protein. There is rise in the level of protein during pregnancy, and this is the reason is the fetus and the placenta actually accumulates about 500 gram of protein. Okay, maternal blood urea drops by 15 to 20 mg. This is because there is a slow breakdown of amino acid. Now in carbohydrate, there is an sensitivity. The insulin sensitivity actually decreases by 44%, uh, which actually where the mother's fasting period becomes hypoglycemic and postprandial becomes hyperglycemic. Okay, so this is also the reason as to why during ANC time we do an OGTT test for every mother, which is oral glucose tolerance test, where a mother is given 75 gram glucose. She is given, and after 2 hours, her blood sugar has been checked. Okay. Now, um, in fat metabolism, 3 to 4 kg of fat has been stored during pregnancy, and it is stored in abdominal wall, breast, hips, and thighs, especially during pregnancy. The good thing that happens is there is an increase in a HDL lipid, which is good lipid, right? And it rises by 15% and triglyceride by 50%. So coming to weight gain and water metabolism, the total weight gain has to be 11 kg for a single term pregnancy. The distribution is 1 kg in the first trimester and 5 kg each in second and third trimester. What the water retention is, the total water retention is 6.5 liter. Okay, by the time mother reaches term, and where the active retention of potassium is 300 micro milli equivalent, and then sodium is 900. Okay, now what happens in endocrine changes? uh, During pregnancy, the placenta actually functions as an endocrine gland, sorry, organ, and that is why the placenta actually produces hormone, which is essential for pregnancy maintenance. Now those hormones are HCl, human placenta, lactogen, estrogen, and progesterone. All these are being actually secreted by placenta. Okay, so now lastly, let's see the systemic changes and certain clinical implication. First, the cutaneous changes. We see the mother suffering from pigmentation on her cheek, forehead, and eyes. This is also a sign of pregnancy, and this pigmentation is actually also in medical term called as chloasma gravidarum. Okay, And during abdominal examination, you'll also see linea nigra and stria gravidarum, which is stria gravidarum is also known as stretch marks on abdomen, and linea nigra is a brownish black color line, okay, in between the abdomen. We also see a vascular spider or a palmar erythema also. This is because of high estrogen level. And now in musculoskeleton, what do we see? There is an because there is a ligament softening, there is an increase in the mobility of the pelvic joint. And other changes that is seen is there is a lumbar lordosis, which is like the curvature of a back. So this is also the reason why the mother complains of back pain also. So during pregnancy, there is a high absorption of calcium, and the fetal demand is almost of 28 grams. So that is also the reason why during ANC time we ask mother to take calcium, okay, and which is like 6 months during 6 months during ANC, and after delivery also for 6 months she has to take calcium. So now let's see the changes in gastrointestinal. The first is you'll find there is a diminished muscle tone and motility due to progesterone hormone. So that is why the mother complains of constipation. Number two, there is a relaxed cardiac sphincter causing heartburn. Number three, there is a reduced gastric secretion and delay emptying. And then gallbladder, this is a chances that during pregnancy there can be a stone formation as well in the gallbladder. So now certain clinical implication that as a healthcare worker, what all we need to see, check, or and understand, that these are we should be able to distinguish between the normal and pathological changes in a pregnancy, and provide an appropriate antenatal care and counseling, and recognize early sign of pregnancy complication, and implement timely intervention when any deviation is seen. Okay. Okay, so thank you so much for watching, and I hope the detailed insight into this physiological changes during pregnancy have been informative and valuable. If you like it, do share with your friends and subscribe to the channel.